Welcome back to the most news in the morning. The Senate Finance Committee voting twice to reject a public option on the health care reform bill. Some of those votes coming from Democrats. It's just one of the many roadblocks that the plan has faced, and the White House also trying to get some Republicans in Congress on board. And while they have tried, our next guest really has been a tough sell. Joining us live from Capitol Hill, Republican Senator Susan Collins. Senator, great to see you. We were talking off camera. You said that you don't recall ever seeing times like these. There's so much going on.
There is. I can't remember another time when there were more important issues on the table. You've got the two wars and a major decision coming up in Afghanistan, the healthcare debate, a faltering economy, the need for financial reform, environmental legislation, the cap and trade bill. It's just an enormous array of issues, all of which are extremely important.
Well, this morning, let's take a narrow slice of all of that and talk about health care reform. Are you going to be able to vote for health care reform, do you think?
John, I want to vote for a health care bill, but so far I haven't seen one that accomplishes what I think needs to be done, and that is to really focus on the cost of health care. It's the cost of health care that's the biggest barrier to the uninsured and causes such a struggle for middle-income families and small businesses.
So you say that cost is the central concern that you have, and proponents of this public option have said that's really one really good way to lower costs. But you don't like the public option. You don't like this idea that your fellow Senator Olympia Snowe is proposing about a trigger to a public option. So what do you do?
There is so much that we could do. For example, we could allow small businesses to band together to boost their purchasing power. We could pass medical liability reform. That would have a direct impact on costs. We could revamp the Medicare reimbursement system so that it focuses on quality rather than quantity. That would help to reduce unnecessary tests. We could provide tax credits for small businesses so they could help insure their employees. There is a lot that unites us, and I think that's what our focus should be.
Now, if you were to adopt all of the measures that you have just outlined there, how much do you think it would reduce in America the number of people who are currently uninsured?
Well, 82% of the uninsured are in families where someone works. They either work themselves or they work for small businesses that can't afford to provide health insurance, or they're self-employed. So that's where I would start. And from my conversations with many small businessmen and women, I'm convinced that if we gave them a generous tax credit, they would provide health insurance for their employees. That would substantially reduce the number of uninsured Americans. Now,
I know that you are a very sought-after vote there in the Senate. The White House is certainly pitching you hard. Give us some idea of a behind-the-scenes look here, Senator, at the sales pitch. Just how hard are they wooing you here?
Well, I appreciate that the White House has reached out to me. I've had great discussions with the Director of Office of Management and Budget, with Nancy Ann DeParle, the White House advisor, with Rahm Emanuel. And I hope we can get to yes. I would like to see a bipartisan bill that makes a real difference in reforming health care to expand access and to lower costs without greatly growing the role of the federal government. I don't think that that's what the people are looking for.
Senator Susan Collins of Maine, it's always great to catch up with you. Thanks so much for joining us this morning.
Thank you, John.
All right, we'll see you.